Hello and welcome to PediaTime. I'm your host, and as a pediatrician myself, I know just how quickly our field is evolving. Today, we're going to tackle a huge topic, one that's set to change everything: artificial intelligence. We're going to look at the incredible promise, check in on the progress, and get real about the unique problems we face bringing this technology to our youngest patients.
All right, before we jump in, we have to start with our standard disclaimer. Just a reminder, this content is for educational purposes and it's geared toward medical professionals. It is absolutely not a substitute for your own clinical judgment or professional medical advice. So here's our game plan for today. We'll start with the big picture, AI's promise versus the tough reality in pediatrics. Then we'll dig into the data dilemma, what makes our field so tricky. After that, we'll look at AI in actual clinical practice, some really cool examples. We'll also cover the roadblocks and how we can solve them, and then wrap up by looking at what the future of pediatric AI means for you and me.
Okay, so let's get straight to the heart of the matter. AI is making these incredible waves in medicine, but, it kind of feels like pediatrics is still waiting on the shore. There's this huge, critical gap in innovation that we really need to address.
And this this really says it all. Think about all the FDA-approved AI applications for medical imaging out there. Well, according to the American College of Radiology, only 3% are designed for pediatric use. Just 3%. That staggering number is pretty much the entire reason we're having this conversation today.
I mean, you look over at adult medicine, and AI is already a total game changer. It's making scans safer by lowering radiation doses, it's speeding up workflows like you wouldn't believe, and it's basically acting as an expert second opinion for radiologists. This is the exact kind of potential that we need to be unlocking for kids.
Which, of course, leads to the multi-million-dollar question, why? If this technology is so powerful, why are we stuck at 3%? What is it about pediatrics that makes this so difficult? Well, it really all boils down to what we can call the data dilemma.
So let's really unpack the specific hurdles that we're up against.
And here's the thing. These challenges all kind of feed into one another. First, many childhood diseases are, thankfully, quite rare, but for an AI that needs massive amounts of data to learn, that's a huge problem. Second, and this is so important, kids are not just small adults. Their bodies are constantly growing and changing. That's a moving target for any algorithm. On top of all that, you've got a mix of different imaging technologies, a real shortage of big standardized data sets to work with, and, the simple economic reality that the pediatric market is smaller, which means less financial incentive for companies to invest.
But it is not all doom and gloom. Not at all. There are some brilliant people out there finding clever ways to make incredible progress. So let's pivot from the problems for a minute and look at some solutions, at how AI is actually making its way from theory to the bedside.
Okay, our first case study is something we're all very familiar with, bone age assessment. It's a fundamental part of evaluating growth, and it turns out to be a perfect application for AI.
And this just shows you how it works so beautifully. So on the left, you've got your standard hand X-ray. On the right, you can see the AI has automatically gone in, identified all those key growth plates in the hand and wrist, and calculated a really precise bone age. So we're moving from a radiologist just kind of eyeballing it against an atlas to a truly objective, data-driven number. And just look at these results. They're pretty stunning. A study back in 2019 found that the AI was more than twice as accurate as human radiologists. And the speed? It took the average reading time from almost 3 minutes down to just 21 seconds. That's an 87% drop. Think about all the time that gives back to a busy radiologist.
Okay, next up, let's shift gears to an even more complex, high-stakes area: pediatric oncology. This is a field where data is incredibly scarce, but the potential for AI to make a difference is, well, literally life-saving.
And AI is making an impact all over the place here. It's helping us use low-dose scans but still get high-quality images. That is a massive win for patient safety. It can automate the really time-consuming work of measuring tumors to track how a patient is responding to treatment. And in some really tough cases, like telling different posterior fossa tumors apart, some AI models are actually performing better than human experts.
So we see these amazing pockets of progress. The big challenge now is figuring out how we scale them up. And that really means going back to those roadblocks we talked about and tackling them head-on with some smart, strategic solutions.
What's really encouraging here is that for every single challenge, there's a solution being worked on.
To fix the data scarcity problem, we need more collaboration, things like the children's oncology groups sharing data. To deal with bias, we can use a really cool trick called transfer learning, where you train a model on lots of adult data and then you fine-tune it with our smaller pediatric datasets. To reduce variability, we need standardized protocols. And of course, to handle the huge ethical issues, we have to have rock-solid data privacy and clear regulations.
And all of this brings us to the future, and more importantly, to your role in what's coming. You know, this stuff isn't just happening in research labs anymore. These tools are coming to our clinics, to our NICUs, to our EDs. They are absolutely going to change how you practice medicine and how we train the next generation of pediatricians.
I just love this quote because it captures the shift in thinking so perfectly. A human expert, right, we have a few decades to learn and build our expertise. But an AI model, it can learn continuously from every single new case it sees, forever. It's like combining the experience of thousands of experts into one system. That is the long-term promise here.
So I want you to just take a second and really think about that. It doesn't matter if you're a medical student right now, a resident, or a seasoned attending. How would having a perpetually learning assistant right by your side change your day-to-day work? How would it change how you keep up with everything?
So the future of our practice, powered by this technology, it's going to be predictive, like flagging an infant at risk for sepsis hours before we could. It's going to be personalized, getting away from one-size-fits-all protocols. It'll be educational. Imagine a tireless tutor for trainees. And it's going to be so much more efficient, automating the routine stuff so we can spend more time on the human side of medicine, actually caring for our patients and their families.
This field is moving so incredibly fast, so if you want to take a deeper dive on this or any other cutting-edge pediatric topic, I really encourage you to visit our website, which is built for medical professionals like you. It's PediaTime.com.
Thank you so much for joining me today. If you got some value out of this explainer, do me a favor and hit that like button and subscribe to PediaTime. We're really trying to build a community here for pediatric professionals, and honestly, your support makes a huge difference.
And just one final time, all of this was for educational purposes. Always rely on your own clinical judgment. Thanks again for watching, and I'll see you in the next explainer.